Hello guys, hope you're all okay. You're all enjoying your life. You're also enjoying practicing ultrasound. And welcome back to Dr. Arshandeep Awan ultrasound teaching videos. I do hope that everything would be all right on your part. Today, my topic of discussion is hemochromatosis and haemosidrosis. These two are the terms used when there is iron overload. So let's start first from hemochromatosis. Hemochromatosis is an autosomal recessive condition in which there is iron overload and iron start depositing within the liver cells. It's not involving only the liver, but it also start involving myocardium, skin, and pancreas. So this would be called as hemochromatosis. Hemochromatosis has, risky consequences, like it will lead to liver cirrhosis and it may likely to develop hepatocellular carcinoma. So that's why hemochromatosis is one of the very important disease which we have to pay attention so far the radiology is concerned. The another one condition is hemosidrosis. Hemosidrosis is a condition in which there is also iron overload, but that is due to multiple transfusion. And this iron load not only involving the liver but also involve the spleen and the bone marrow as well. There is no risk of liver damage and there is no consequences of the liver cirrhosis. Only the liver cirrhosis is related to hemochromatosis. How these both conditions will appear on the ultrasound imaging, how it will appear on non-contrast enhanced CT, what are the findings on the MRI, and how we will go about that. So this video contain all these information. So let's start watching these images and hopefully you will be able to differentiate between hemochromatosis and haemosidrosis. This ultrasound image shows hemochromatosis status. Look for the image. This is the image of the liver and it shows increased reflectivity. As far as iron overload status is concerned, whether it is due to hemochromatosis or it's due to increased blood transfusion in case of haemosidrosis, in both conditions the liver will appear slightly echogenic, but it depends upon the degree of the stage. Like in hemochromatosis, as I mentioned earlier, it will lead to liver cirrhosis. So if in case the liver cirrhosis is developed, so you will see that the reflectivity of the liver would be reduced and there will be slightly granular pattern. Focus on this image, you will be able to appreciate that parenchyma is not homogeneous. Its reflectivity is slightly heterogeneous, and as far as internal parenchymal presentation is concerned, it looks slightly granular. So this is the case of hemochromatosis, which ultimately leading towards the cirrhotic condition as because of the iron overload. This is another ultrasound slide. In this view you can appreciate a well-defined kidney, and beside this there is a left lobe of the liver is visible. On this left lobe of the liver you can appreciate that slightly reflectivity is increased as compared to cortex of the kidney. So it's mean this is also a case of haemosidrosis. The patients gave the history of multiple blood transfusions. So because of multiple blood transfusions, his iron level was increased than the normal. In the blood iron level, they have been monitored for the blood iron level, which was increased, and on the ultrasound imaging the liver shows increased reflectivity. So there is no pattern of cirrhosis. Liver margins are normal. Liver reflectivity is slightly increased because of the iron overload. The one thing, if you don't have any history, so you may be confused with the fatty infiltration. So it more mimic like a fatty infiltration, but if you do have the history and the patients have been given multiple blood transfusion, so instead of writing fatty hepatic steatosis, you better go straight away for the haemosidrosis. For the confirmation of hemochromatosis and haemosidrosis, a variety of radiological imagings are available. The first and the topmost is ultrasound imaging. But with ultrasound imaging there is a confusion, like you may be able to confuse with the hepatic steatosis. So therefore you must jump onto a non-enhanced CT. There is no need for putting any contrast, just take straight away without contrast. CT without contrast for the liver region is required. On the non-contrast enhanced CT, you will appreciate there will be a diffuse increase attenuation of the liver parenchyma. Here on this CT image you can appreciate that the liver echogenicity, its attenuation is increased as compared to spleen. In the view in the image you can appreciate the spleen attenuation is normal, it's a soft tissue attenuation, while the liver attenuation is increased. As far as internal vascular pattern and portal venous system is concerned, that appears to be a normal attenuating, while the parenchyma of the liver shows increased attenuation, and this is the case of hemochromatosis. So hemochromatosis will appear on the CT scan images like this. Another CT scan image, still it shows slightly increased attenuation of the liver parenchyma as compared to spleen. In the view you can appreciate the spleen which shows normal attenuation, while liver shows increased attenuation, and that is because of the iron overload. Patient history showed that he has multiple blood transfusion, so that was secondary to transfusion, and that condition is not hemochromatosis but this is hemosidrosis. So hemosidrosis will shows increased iron level within the blood, and there will be history of multiple blood transfusion. So in this image you can appreciate normally the liver is not enlarged, it's a normal size liver, but it shows increased attenuation, while spleen appears normal, no other abnormalities detectable, liver parenchyma is normal. In case of hemochromatosis, you because it eventually lead to hepatocellular carcinoma, so therefore you must look for the internal hepatic lesions, or means space occupying lesion. But so far hemosidrosis is concerned, there is no chance of developing of hepatocellular carcinoma. This patient is hemosidrosis, and in small tiny calcific foci can be seen. It is not the tumor, it is not any other space occupying lesion, but this is general soft tissue calcification, and that may likely be healed granuloma. So you should not confuse with any space occupying lesion. So this is the case of hemosidrosis, iron overload due to multiple blood transfusions. MRI is the most specific imaging technique. Look for this image. On this image you can appreciate that there is abnormally low liver signals because of hemochromatosis. So this is case of hemochromatosis. Look for the spleen. In that case the liver shows the spleen shows normal signals. This is the difference between the hemochromatosis and hemosidrosis. On hemochromatosis there will be abnormally low signal intensity in the low signals in the liver, while the spleen becomes normal, it will remain normal. This why, because that only affects hepatocytes, and hepatocytes is overloaded with the iron, and that eventually leads to abnormal signals. So that's why in this image you can appreciate abnormally low signals so far the liver is concerned, while spleen appears normal, and this is the case of hemochromatosis. This is another MRI scan. On this MRI scan you can appreciate abnormally low intensity, low signals within the liver and in the spleen as well. So bilaterally in the liver and in the spleen both are affected. That is why, because iron is deposited in the endothelial system, so it affects the spleen and it affects the liver as well. So this is the case of hemosidrosis. So this is the main difference on the basis of MRI between the hemochromatosis and hemosidrosis. In the hemosidrosis the spleen and liver both will be affected, while in hemochromatosis they will only be liver affected because of hepatocyte iron overload, while spleen remains the normal. So this case which is present, and you are seeing that in this The spleen and the liver shows low signals, and that is because of the hemosidrosis. Yes, guys, this was all about hemochromatosis and hemosidrosis. I'm pretty much sure that there will be no doubt left in identifying these two abnormalities and the consequences of these both. But keep in mind that hemochromatosis is one of the risky disease. It leads to liver cirrhosis and it may lead to development of hepatocellular carcinoma. I do hope that this video would have provided you all the information which you required related to ultrasonography and related to non enhanced contrast CT scan. If any doubt left, just drop me a message and I will get back to you. We'll see each other with some new topic. Till then, take great care of yourself. See you then. Bye bye.